Hello, my name is Isabella Teodoro, and I'm a registered nurse working on a pediatric unit in Boise, Idaho. I wanted to talk to you about childhood obesity, its effect on our healthcare systems, and the policies that you can change to help keep this epidemic at bay. Childhood obesity is defined as a BMI at or above the 95th percentile for children and teens of the same age and sex. Over the years since I've gotten my nursing degree, I have seen a rise in childhood obesity and its lasting effects on our community. This rise has put a strain on our healthcare systems and has cost taxpayers millions to correct and keep up with. Recent CDC data explains that the most costly but preventable and avoidable obesity-related conditions are heart disease, cancer, stroke, and diabetes. These issues not only impact a person's childhood, but will often continue to impact them into adulthood and therefore increase the amount of healthcare visits and medical needs from that individual, often for life. I have seen these preventable health concerns rise firsthand and have witnessed the lives forever impacted or even taken by these diseases that are entirely avoidable. You may be wondering, why now? You may think that obesity is a common problem that doesn't have a lasting impact, but this is completely false, and you as a policymaker have the power and civil duty to change the trajectory of these statistics. According to the Idaho Department of Health and Welfare, 1 in 5 children is overweight or obese by age 6. This is even more concerning when we look at the fact that 3 times more children are obese today than 30 years ago. This is a problem that has risen over the last few decades due to a decline in food quality in the United States, a shift in need for an active lifestyle, and an overwhelming rise in the availability of artificially foods and sweetened beverages that are often marketed towards the younger generations. A policy change that I believe could easily be implemented into the Idaho law is an excise tax on sugar-sweetened beverages. Currently, Idaho does not have an excise tax on these sweetened beverages, and I believe that based on studies that I have researched, it is the greatest chance of lowering childhood obesity. With this policy change in effect, we will spend less money on obesity-related health care and have healthier generations for years to come. Some may argue that the need for comprehensive solutions such as education, public awareness campaigns, and need for a multifaceted approach beyond taxation are needed to help end this issue. And to this I agree. Addressing complex health issues like obesity do require comprehensive strategies. I believe that taxation can be a stepping stone to introduce this into the community. We can then use the money we receive from tax dollars to provide education and awareness for the issue so that we can help eradicate the problem before it worsens. I ask this of you because I deeply care for the Boise community and the Treasure Valley as a whole. I know that you also share these values as you too have dedicated a career in community service and betterment. I'm aware of how busy your schedule is, but would be thrilled to follow up with you in the coming weeks so we can make a change together. Thank you so much for your time today, and here's my contact card and a paper of a brief synopsis of what I went over with you today. Thank you.